And Mike has a question from Livonia for Dr. Michael Gray here on News Talk 760 WJR.
Hi, thanks for taking my call.
No problem.
I just have a relatively quick question. I am in my early 20s, and I boxed for quite a few years, and around the age of 16, my nose seemed to become a little bit wider, and I'm not sure if it's a result of getting older or the boxing, but it's a little bit wide, and I was just wondering if you'd know if that could be like a hereditary thing, or could it be a result of being a boxer and getting punched in the nose a bunch of times?
It's probably from being punched in the nose a bunch of times, but, genetics does play a role because you do, break bones, you do interfere with the growth plates and the cartilage and all that stuff. So, of course, I'd have to look at your nose and see what's going on with it, but, if you're being punched, and only you would know this, how many times you took a direct hit into the nose, it does affect, the appearance.
I'm just curious also, what is a general ballpark figure for a procedure involving slightly reducing the size of someone's nose?
There's no way really to say that because each physician is different with what he needs to do. There's no set prices in this. And depending on what's going on with your nose, if there's a breathing problem, your insurance may participate in this. So I would direct you first to go to an ear, nose, and throat physician, not a cosmetic surgeon, because if there's a difficulty with your airway, your insurance may cover this.
All right, great. Thank you very much.
Thank you, Mike. We go from Mike in Livonia to Mike in Novi, who has a question for Dr. Gray. Mike?
Hi, folks. How are you?
Good.
Good. Doctor, I got I know pricing is part of the picture here, but I have a real simple one. I have a daughter who had a wart removed when she was probably, 15 years ago. She's in her early 20s now, and it's on the knuckle of her thumb, and it's probably about the size of a pencil eraser. And it's, it's unsightly enough to bother her. And I'm thinking, what little I know about plastic surgery, make an incision, cut it out, some fine sutures, close it back up. There's probably still going to be a line scar there, but is that something that your office does? I mean,
yes.
Do you have to see a hand surgeon? Or?
No, it's involving the skin, but you have to remember, there are lines around the knuckle anyway, and it may not require an excision. It may require fillers. So if the scar is depressed, we can elevate it.
Actually, it's kind of, you know what it was? It was a wart removed with a laser, so it's kind of a flat spot, a little bit whiter, that type of thing. And I guess my question is, you say your office does those types of things?
Well, I do, yes.
Yeah, I mean, it's because it becomes a great Christmas present, So.
Yeah, no, I understand that. She's how old? 20?
21. So almost 22. So
okay.
She had this done when she was probably 4 or 5.
No, is it the color that bothers her?
It's the color, and you can see that it's a scar. And like I say, it's...
Well, there's also medical tattooists. We have them in my office that we can tattoo it the color of the skin. So there's different options that she has. She doesn't just have to go with an excision of it. So I would review that with you, but if you can snap a picture of it, it would be great.
Oh, sure. Could I snap that and take it?
You'd have to take it without her knowing because this is a present, right?
My daughter looks like a log. Yes, absolutely.
Yeah. All right.
That part's easy.
Okay.
Okay. So do that and then get it to your office.
Yeah, and then I'll be able to answer your question. Like if you came in and you show me the picture, we can talk about it.
Okay, that sounds great.
All right.
Mike, thank you so much for your call.
Thank you.
800-859-WJR, 800-859-0957. Before we go to the break, Doctor, I want to ask you about this ad with Brooke Shields for this FDA-approved prescription treatment for fuller eyelashes. Latice.
Yeah, it was originally a glaucoma medication. When they used it for the treatment of glaucoma, they realized that people's eyelashes were growing. And, of course, this is off-label use.
Mm-hmm, mm-hmm.
So it's now approved by the FDA as they had further studies and evaluations by the company who manufactured it, and now it's improved for growth of eyelashes.
Is there a side effect for having
it can pigment the upper lid skin. It can pigment the color of the eye. Usually those are very rare occurrences, and you can stop using it. It's something that it's going off the shelves like hotcakes.
Yeah, I see. And welcome back to The Big Story. Dr. Michael Gray from the Michigan Cosmetic Surgery Center and Skin Deep Spa is here in studio to take your questions at 800-859-0WJR, 800-859-0957. His website is anewyou.com. Dr. Gray, you also have the Skin Deep Spa, and there are certain things that you do there as well. You have the spa facial, the spa body. One thing I wanted to ask you about is the tattoo removal, because now you have a lot of young people who decided, well, maybe I shouldn't have got this tattoo on my neck here, and so I want to get it removed because I'm going into the corporate world. I need to wear a shirt and tie, and it doesn't look right to have this big tattoo on the side of my neck. Can you remove that?
Yes. We have lasers that remove tattoo. Tattoos are the biggest regrets people have, because it's not that they regret getting a tattoo. It's regret getting that tattoo, because they're always, their personality, everyone's evolving, their personality changes, their likes, dislikes, and what you like at one point in your life is not necessarily what you want in another part of your life. So when you place these tattoos that are visible when you're wearing certain outfits, it can affect what happens to you in your future. What
are some of the other procedures at the Skin Deep Spa?
Well, Skin Deep was formed for non-surgical intervention and prevention. It's not basically a spa. We do offer spa packages and things like that, massages and other things, but it's more for the treatment of your dermis, your skin, as well as we treat cellulite, we treat pigment, brown spots on the face, on the body, hyperpigmented scars. We talked about scars that are red. We treat those. We treat blood vessels in the skin. We treat hair, laser hair. We have the newest laser that's out there that does all color skin types, and you can be tan. It doesn't matter now. Okay. We treat skin imperfection. Acne is a big one. We treat that. Making our complexions better. Tattoo removal. We treat fine lines and wrinkles over it. We have lasers that are not as aggressive as the CO2 laser, where you may have some recovery. These lasers, there's no recovery. We tighten skin using lasers. We tighten skin using radio frequency waves. A whole bunch of things that we offer.
800-859-0WJR, 800-859-0957. If you have a question for Dr. Michael Gray, let's go to the phone line to take this call from Canton, who has a question for Dr. Gray. Good evening.
Good evening.
What's your question?
Dr. Gray. Thank you for taking my call.
Hi.
Okay, I have a 12-and-a-half-year-old, and she's growing the same nose as I. And I had my nose surgery when I was in my mid-20s. And I know that she's been talking about how it's bothering her, what's the changes it's making, and the teasing she's getting. At what age? I know she has to mature more.
Typically around 16. She'd have to wait to the face grows a little bit more. You don't want to do it in the midst of the growth, because one, you can interfere with how it's ultimately going to end up, even if you do a surgery. And one, you want to wait to see when it stops, then you can fix it.
Yep, I understand. Okay, great.
I would wait.
Thank you for your call.
Thank you.
Let's go to Valerie from Farmington Hills with a question for Dr. Michael Gray. Valerie, good evening.
Hi, how are you?
Great.
I really need some help and an answer to this question, because when you say you can liquefy the fat with the laser, here's my question. I've had diabetes for a long time. I really feel 35, and I haven't lost sight or anything like that, thank God. But I have gained weight, and I have, which I forgot what you call it, that stomach that hangs.
Well, we call it a paniculus, if it hangs over the edge.
Well, yeah, I mean, it's like dropping.
Yes, we all do.
Well, I'm 65, but I just met somebody and I want to get married and I want this stuff fixed.
Right.
So my question is this. If you were to go in there and take out, through liposuction, the fat that's an apron stomach is what I was thinking of,
yes.
and you take that out, will that help diabetes? I mean, the diabetes that I have, because everything settles in the front.
Yes. Reducing volume of fat does help diabetes. So whether you do it with exercise or you do it with liposuction, it will help. Regarding the apron, though, a tummy tuck will tighten the skin. All tucks and lifts tighten skin. So only the fat that's hanging over the edge when you do a tuck will be removed. But if you have more volume above, then what we're reattaching to below, there's a drop-off there. So that's where liposuction will come into play. So you have to evaluate what bothers you more, the hang or the volume.
Well, actually, I would rather I'd rather have you look and tell me.
No, I understand. I will, but I can't do that on the air. But I want you to start thinking about it so you can look at things with a different perspective or a different eye.
Okay.
Okay.
And the next question is my face. You know, as you get older, you get that little fuzz on your face. Not a lot, but it's enough to, it's distracting.
Talking about peach fuzz?
Yeah, or like just around, you know, like the bone line of your jaw.
Right. Well, you know, everyone has some sort of peach fuzz on their face. If you know, laser hair is more for pigmented hairs. It's not for the peach fuzz.
Oh, I see.
So
okay.
what would be left would be epilation or waxing or shaving. But I wouldn't recommend shaving.
What is epilation?
It's where you use electro pulses and you stick a needle into the skin and actually vaporize and injure the hair follicle. The hair falls out. But that really doesn't. You're not really using that on peach fuzz.
Okay.
More for hair.
All right.
Dark hair.
Okay. When can I make an appointment?
Whenever you like.
Okay.
We'll give you the number. It's 248 538 3333.
538. Excuse me.
3333. Lots of threes.
Oh,
538 4 threes after that.
Okay. All right. Great. Thank you so much.
Valerie,
No
thank
problem.
you so
You're
much.
welcome.
Doctor, you got to get Valerie ready. She's ready to get married. You got to get her ready for the
we
wedding.
want to. That's the whole point of this.
All right, very good. Thanks for coming in.
Thank you very much. I
really
enjoyed being
appreciate it.
here.
We got to get you back in here again. We had some calls we couldn't get to, but we will have you in here again, and we will get to those calls. Thank you so much.
Thank you.
And thank you for listening to The Biggest Hour on Detroit Radio. My producer tonight is Rosanna Kelly, engineer Rob Blassick. Remember, for more information on Dr. Gray, you can go to anewyou.com or call 248-538-3333.
Talking about what matters to you. Catch it live on News Talk 760 WJR AM and stay up to date online at WJR.com.